Good morning, everyone. Myself, Krishna Priya, Department of Operation Theatre and Anesthesia Technology, Allied Health Science from Sri Shanmuga College of Allied Health Science. Today, we are going to talk about face masks. It is the device which allows administrations of gases to the patient from breathing system without introducing any apparatus to the patient's mouth. A face mask can be made up of black rubber, clear plastics, elastomeric material, or combination of these. Parts of the face mask. It has a body, seal, and connector. Body constitutes the main parts of the mask. Transparent body allows observations of moisture, whites, secretions, etc. And seal. Seal comes in contact with the face. Two types are available. First one, pad or cushion type of seals. It is inflated with air. And flap type, flexible extensions of the body. Next one, connector. Opposite to the seal and thickened fitting of 22 mm and a ring with hooks helps in strapping the mask. Specific masks. First one, anatomical mask. Anatomical mask can be molded to conform to the anatomy of face. Has slightly malleable rubber body, a short notch for the nose and a curved chin section. And second one, Rendell Baker Shaushik RBC mask. Designed for pediatric patients below 10 years. It has a triangular body and how dead space, and a low dead space. Used in tracheostomy and acromegaly patients. Next one, endoscopic mask. Designed to allow mask ventilations during endoscopic procedure. It has port or diaphragm in the body to allow fibroscopic incision. Next one, scented mask. Scent incorporated into the mask by manufacturer or anesthesia provider. Added for better accessibility and pleasant experience during induction. Disadvantages of scented mask. Ethyl alcohol in some flavor may affect accuracy of gas monitors. It available in many sizes. They are 0 size for preterm babies and first 1 size for infant babies and 2 size for 1 to 3 years child and 3 size for 4 to 10 years children and 4 to 6 sizes for adult female and male patients. Techniques of use. The face mask should form tight seal on the patient's face while fitting comfortably in the user's hand. The smallest mask is most desirable because it will cause least increase in dead space, easy to hold and less likely to result in pressure on eyes. Methods. One hand method, two hand method, two hand jaw thrust and claw hand technique. Next we will see one hand method. The thumb and index finger of the left hand are placed on mask body on opposite side of connector pushed downward to prevent the leak. The remaining 3 fingers are placed on the mandible such the middle finger is applied to the mentum. Ring finger and body of mandible and little finger at angle of mandible to give jaw thrust anteriorly like this picture. And second type, two hand method, as it requires both hands as second person is necessary for assisted or controlled ventilation. Her thumbs are placed on either side of body of mask. Index fingers are placed under the angles of jaw and mandible is lifted and the head is extended. If a leak is present, downward pressure on mask can be increased by anesthesiologist chin on the mask elbow. Next method, two-handed jaw thrust method. One person stands at head end of patient's and performs jaw thrust with his left hand at angle of left mandible while his right hand compresses the reservoir bag. The second person stands at patient's shoulder facing first person. This person right hand covers the left hand of the first person and the left hand achieves right-sided jaw thrust and mask seal. The last method is claw hand technique. It is useful for children undergoing short duration procedures. The anesthesiologist stands at the side of bed facing the child. The face mask is applied to face by using the right hand with the palmar surface facing upward. The ring and middle finger are placed under the angle of jaw and thumb encircle the body of the mask. Okay, dead space in face mask. Face mask and its adapter increase dead space and it may contribute 30% or more of tidal volume in neonates and infants. It can be reduced by using smaller size masks, increasing pressure on mask, blowing a jet of fresh gas into the mask, changing the volume of seal cushion. These are the preventive measures for dead space in face masks. Next one. Advantages of face mask. Lower incidence of throat, requires less anesthetic depth than tracheal tube or supraglottic devices. No need of muscle relaxants, and the face mask may be the most cost efficient method for short cases. Disadvantages of face mask. Anesthesiologist hands are tied up. Higher fresh gas flows are often needed. During remote anesthesia, airway access is difficult. CT and MRI procedures. After more episodes of oxygen desaturations and require more intraoperative airway manipulations. Complications during face mask ventilation. Skin problems, dermatitis, pressure necrosis, and nerve injury, eye injury. Eye injuries like conjunctival chemosis, eyelid edema, and corneal injuries. Gastric inflations, latex allergy, lack of correlations between arterial and end-tidal carbon dioxide, environmental pollutions with anesthetic gases, and jaw pain and user fatigue. And also sometimes causes jaw injuries and dental injuries. Okay, thank you so much.